Tarantino. I'm a pediatric hematologist, and I practice hematology in the state of Illinois. I'm the medical director of the Bleeding and Clotting Disorders Institute. So it's a treatment center for people with bleeding and clotting disorders, including ITP. I don't know that I could even properly express the challenge or frustration that some patients have with ITP. It's just perplexing, it's devastating when they have to live with very low platelet counts and fear that something bad is going to happen. The symptoms of ITP, the common symptoms are bleeding, and usually that manifests most in the skin or on the skin. So many of them just have extensive bruising, smaller little red dots under the skin we call petechiae, which are little tiny bruises. And that's sort of the mild end of things, but things can get very severe, and sometimes the bleeding can be life-threatening. Children with ITP that need a medication therapy have typically experienced frontline therapy, and that didn't result in a resolution of their ITP. Often that involves corticosteroid therapy. And particularly in children, we don't want to use corticosteroids for any great length of time because we know that's associated with sometimes deleterious side effects, including some that might affect their growth. NPlate as an option for ITP in children is really exciting because we know from the phase 3 clinical trial that we participated in that there's proven efficacy. So we know that it's a drug that will work for most kids.
Se estudió NPlate versus placebo en un estudio de fase 3, aleatorizado, multicéntrico, doble ciego de 24 semanas en pacientes pediátricos con TIP que habían completado al menos un tratamiento previo y tenían un recuento de plaquetas menor o igual a 35.000 por microlitro antes de entrar al estudio. Los pacientes fueron asignados al azar a 24 semanas de NPlate o placebo. El objetivo principal de eficacia fue medir el logro de una respuesta plaquetaria duradera. El objetivo secundario fue medir el logro de una respuesta plaquetaria general. La respuesta plaquetaria general se define como una respuesta plaquetaria duradera o una respuesta plaquetaria transitoria. El 71% de los pacientes pediátricos que recibieron NPlate lograron una respuesta general y el 52% logró una respuesta duradera.
When we consider a second-line therapy for children with ITP, we want to give a medication that has proven efficacy. The phase 3 clinical trial really shows that demonstrably.
El perfil de seguridad pediátrica de NPlate se estableció en un ensayo de 12 y 24 semanas. Las reacciones adversas con una incidencia mayor o igual al 25% en los dos ensayos controlados con placebo fueron contusión, infección del tracto respiratorio superior y dolor orofaríngeo.
Stability in ITP, to me, means a platelet count that I know will be associated with a very low risk of bleeding. And the schedule of having the children come in weekly is really not that burdensome to most families because they are really looking for some therapy that's going to work, that's going to give a rise of the platelet count into a hemostatic range. The biggest take-home message is that it works. When the platelet count rose in a child where multiple therapies had not given any response, I mean, the parents and the child were ecstatic about that. They know that the higher their platelet count is, the less likely it is that they're going to have some kind of bad bleeding event, and they can use a medicine that raises their platelet count to a stable level.
NPlate ha apoyado a los hematólogos y su compromiso con el cuidado de sus pacientes durante más de 10 años.
Having NPlate as an option really has changed things for treaters and for patients. Based on the clinical trials, based on subsequent publications, based on our own clinical experience, it does have proven efficacy, and it does work well to bring the platelet count into a hemostatic range.